as well. Some question answers and actually keeping up on the sessions, etc. So to give some free advice, and she actually does that in pre-op cost. So which is very nice of Dr. Mohana ji actually to come here today and give us all this presentation today. So Mohana ji, please go ahead and you can start your session today.
So
And I will request everybody to be on the mute so we don't disturb her. Thanks.
Thank you all for coming for this session. I'm Mohana. I'm a volunteer counselor with the SHIP program, that is State Health Insurance Program. In Michigan, the area agency is called Ageways. In each state, all the states have area agencies. These are for seniors, they're meant for area agency on aging. But in Michigan, they have now started calling it Ageways. Okay. And I've been doing this since 2014. There are people who work as employees, but there are people like me who do only as a volunteer counselors. Okay. And it is so very, very fulfilling. So most of you from our Indian community, we don't have that many people doing this. I request all of you, this is an amazing, amazing training program. And the rewards are amazing. When you help older people, it's very, very fulfilling. So I would never want a penny for that. I get more than that by just serving people. Okay, so having said that, so let's start on Medicare and Medicaid. The other thing I want to say is Medicare has been made to look that it is confusing, this is that, it is hard, and nobody can understand. Actually, it is very simple. And when you go to the SHIP counselors, they will sit down and explain to you how you can do it yourself. That's what I try to do. Whenever I go for a session, we have one-on-one sessions in Michigan. I make them sit next to me and I'll show them everything. And I'll tell them, look, I'm empowering you. You can yourself do it. And I'll try and break it up into a very simple. Most of you must be knowing a lot. So sorry if I'm going to repeat all that, but just bear with me. So let's make it very interactive. Hold on to your questions. And if it is very crucial to ask right in the middle, you can ask. But let's make it very interactive and interesting for everybody. So having said it, let's start. So then, okay. So as I've said, it's a nonprofit with a wide variety of programs. In every state you have it. All area agencies are there. Okay. And then if there is a phone numbers, when you call these places, when you call area agency for seniors, there are lots of programs and you can find out if you qualify for it. This is the phone number. I'll send it again on the WhatsApp group. Okay. So now, as you know, what is Medicare? Most of us know that it is meant for 65 years and older people. But do you know that Medicare kicks in for people with disability?
Sorry, your screen sharing is paused. Can you?
Mine is paused?
Yeah.
Oh, yeah. So what, I just have to click it? Yeah.
Yes, reshare again or click it again on that.
Yeah, it is shared. Okay, shall I do that?
पासकोड कशाला घालायचं त्यामध्ये आपोआप लिंक उघडायला पाहिजे ना.
Yeah, now it is okay.
Does
it still say it is paused?
No, it's not. It's okay. We
Everyone,
can't.
please keep quiet.
We can't see the.
Can you?
Yeah, she's putting it. Yeah.
Everyone, please
Monaji,
keep
we
quiet.
cannot see it.
I do have to put the passcode.
No. Do you all see it now? Do you all see 65 years and older slide?
No.
No.
Why is it? It says it is. Did you, Chaya, you are the co-host, right? And see
Do not
if
have your slide on this computer. Yeah.
Okay, now this is stop share. I did it. Okay.
Better
Okay.
now.
Now I'll go back to the slides and see whether I can share.
Yeah.
Okay. Now, do you see? Oh God.
It's coming.
Yeah. Yes.
हे
Now do you
unmute का
see it?
स्वतः करत नाहीत मला
Yeah.
कळत नाही.
Yes. Yes.
होस्ट नाही का?
This is the slide we needed. Okay.
Huh.
So I was talking. Can you please see this slide?
Yes.
Yes, we can see it now, Mohana
Okay.
ji. You can
Could
continue.
you put it in presentation mode, please?
Mohana ji, yeah, from the current side.
There
Yeah.
you go. Now is it
Put
okay?
Yeah.
I think it's
That will
okay
be
now.
better. Yeah, it's better
Yeah.
now.
So now we always think that Medicare is meant for 65 years and older, but then there are people who go on disability. When you go on disability for the first 24, as soon as you,
Excuse me.
somebody is chatting, please mute
I know I
yourselves.
mute them by so many.
Okay.
They
Okay. And let me start again. As I said, there are people with disabilities. When you go on disability, you may get Medicaid for 24 months. Okay. And then at the end of 24 months, immediately you will be put into Medicare. And if you're from social, when you get social disability from Social Security, if it is more than the Medicaid amount, then you won't get Medicaid. But some people, their disability amount will be less than the amount for Medicaid. Okay, so those people will get dual eligibility. That means they are eligible for Medicare and they are eligible for Medicaid because of their disability. So at the end of 24 months, all disabilities people will get Medicare also. And anybody with renal disease, kidney disease, also gets Medicare. It doesn't matter the age. Okay. And then this Medicare is administered by Center for Medicaid and Medicare Services. And the enrollment is through Social Security. The first time when you get enrolled, you go to the Social Security office and you get enrolled. And that is the first time enrollment. Okay. And then as soon as you enroll, you will get a letter. Either you go to it's sent to people who go to SSA to sign up for their Medicare. Okay. And so people who draw Social Security, they automatically get Medicare with less than 3 months. Always remember, the first time when you join Medicare is when you turn 65. That is 3 months before 65 and 3 months after 65, you can sign up for your Medicare. And then there is a month in between. The month you are born, 3 months before, the month you are born,
Yes.
and 3 months later. That's
How
the
to
time
thank
period
you,
you get to join Medicare.
How to join che?
Okay.
people are
But then
joining
there
and they
are
are
people, then as soon as you apply, within a few weeks, you'll get your Medicare card. The Medicare card, as you all know, it has Part A and Part B. And all of us by law, once you turn 65, you have to have Medicare. If you don't join Medicare, or if you don't have creditable health coverage through your employer, you will get penalized when you join later. Please remember that. So how to enroll into Medicare? Enrollment is not automatic. If you don't get Social Security or RRB benefits, it will not be automatic. And please be aware, some of the companies will not tell you. You've got to find out. They want you to have a Medicare card with Part A. And I'll be talking about that again. So then you are the one who's supposed to go to the HR when you turn 65. Go and talk to your HR and say, hey, I'm turning 65. Do I need to get a Medicare card? Will you all cover my Part A? Will you all cover my Part B if I work for you all? So some of the companies will say, it's fine, we will do Part A, Part B, everything is covered for you as long as you work with us. Or some companies will say, no, you have to get your Part A. So then you have to apply to Medicare. Your Medicare card will say Part A and Part B. you are supposed to deny Part B. Just get your Part A, and Part B will be covered by your employer if he is willing to cover your medical expenses. Okay. And then if you go to any Social Security office, will help you how to join Medicare. And this railroad, there are some people who work for the railroad board, and those are the people, they have to go to their own railroad board and get their enrollment. This is how the Medicare, everybody knows how the front and the back looks. And see, it says Part A and Part B. You need both Part A and Part B. Now, let me explain what Part A and B is. Okay, Part A is like this. It is for hospital charges, and Part A is free for people who have creditable service in this country. At least if you have worked for 10 years in the country, then your Part A becomes free. Otherwise, Part A is very expensive. I will tell you later how much it will cost you. So Part A is like this. It lets you go and lie down in the hospital. Okay. But for the doctor to come and see you, get your blood check done, this thing done, that thing done, to give you treatment, you need Part B. That is what it is. Part A is hospitalization, which is free for people who have worked in this country. And Part B is for all medical, like blood tests and all the health checkup and everything else. Okay, then people get a lot of confusion about what is premium, what is deductible, what is copay, what is coinsurance, cost share, and all those things. Premium is a set amount you will have to pay for a plan. Once you join Medicare, and then I will talk to you about the different parts of the Medicare, premium is a fixed amount, which every month you have to pay. Like the premium for Part B is something fixed, and it will be deducted from your Social Security every month. That's a fixed premium. The deductible is, again, we have a deductible. Medicare has a deductible, which is a set amount you pay once a year. And once you finish that, once you finish your deductible, then the other charges starts. You first pay from your deductible. Then there are things called co-pay. This co-pay is it's very, very this thing for your prescription drugs. It's when you go and buy your medicines, you will be knowing that you'll have to pay a certain amount of money. And that's also fixed pay. That amount is for particular drugs. The copay will vary. If you have branded drugs, you may pay more copay. And if you have generic drugs, you may not even have to pay any copay. And then co-insurance, what happens is, co-insurance is just like the copay, you can say, it is the percentage of your insurance. It will tell you. So when you, like in Advantage plans, when you join, it will tell you this much of the percentage of the insurance you have to pay for this service. If they give you a particular service, say a particular MRI, they'll say, there's the co-insurance is this much. So there is a particular insurance amount, and it'll tell you this is the co-insurance you have to pay. And then cost share is the maximum amount you pay out of pocket, including deductibles, co-pays, and co-insurance. But this cost share means when you go into Advantage plans, it will say 5,000 is the out-of-pocket limit. So that is your cost share. In that 5,000, you get deductibles, co-pays, and co-insurance. Now, let's look at Medicare. Medicare has 4 parts. As I said, Part A for the hospital, Part B is for all your medical, and Part C is, again, it's called Medicare Advantage plans. And there is Part D, which is a drug plan. Okay, why do we have to have 4 parts? As most of you all know, Medicare covers 80% of your cost. The 20% has to be paid by the customer. So what happens is that 20% is a big amount. For that, this Part C is there. You can opt to join a Part C, which is called, these are called Advantage plans. Part C has not only a medical component, It has also a drug component. So it's a plan that has a medical component and a drug component. It's together. And these advantage plans have an HMO plan and they have a PPO plan. So most of you who are working in this country are already aware of HMOs and PPOs. And even in Medicare, if you go into an advantage plan, your premiums will be very low, especially HMOs. Your premiums are low and your network is very much restricted. So that is HMOs, okay? So if you join a Part C PPO, your premium may be a little more, the amount you pay for a specialist may be a little more, but you have a little wider network. With an HMO, as you all are aware, we are restricted. We have to go to our primary physician. We are under his mercy, right? He decides who is good for you, whether you need a referral or not. With the PPO, you have the independence or the freedom to call a doctor and say, look, I need an appointment. But even that PPO has to be in your network. If he's outside your network, you will be paying a big amount. Okay, that is advantage plan. Now we come to Part D. This is for drugs. This is prescription drug plan. Part D plan, is very important because, but remember, if you do not join Part B and take your own time, and if you don't have creditable coverage, you will be penalized. The same way with Part D. There are some people who think they are absolutely healthy, so they don't need prescription. Why should I need a Part D drug? I have a client who is a doctor, who is a retired doctor. She's so healthy. She's now like 80. She does not have a drug plan because she thinks she doesn't need to have it. But by God forbid, if you fall sick, after 80, you can fall sick very frequently. And then you need medications. Then you have to join Part D. And for that, you will be heavily penalized. To avoid that, please join your Part D. It's called drug plan. When you do an advantage plan, this Part D is already inside that. So you don't have to worry. It comes like a package. But then there is something called the supplemental plan. The supplemental plans are also called Medigap plan. So they fit between the Part B and the Part C. So they are called supplemental plans. Those supplemental plans or Medigap plans are standalone plans for medicine for Part B. They are the Part B plans which help you with all the medical services, blood tests, admission into hospital, those advantages. And whenever you get admitted for emergencies, even when you're traveling with Medigap plans, you can use it outside the country. But that is called a Medigap plan. In the Medigap plan, then we will discuss how a Medigap plan works. But once you get a Medigap plan, you need a drug plan, okay? You need a standalone drug plan. So here, when you do a Medigap or a supplemental plan, you not only need a supplemental plan, you got to get a Part D or your drug plan, which depends, the cost depends on what kind of medications you're taking and all that. Okay, here again, this slide again explains to you about Part A. As I told you, let's revise it. Part A is hospital insurance. Part B is medical insurance. And then for your prescription, it's called Part D plan, which I had already talked about. Then you have a Medigap plan. This plan is called a Medigap plan or a supplemental insurance. Medigap policies help pay your out-of-pocket costs in the original Medicare. Okay, so once you get a bill from Medicare, as I said, Medicare will only cover 80%. The 20% is there. So this Medigap helps you when you have a plan that will cover that part of anything that the original Medicare covers, and the 20% will be covered by your Medigap plan. And okay, once you take now we are talking about an advantage plan, which I told you about. Even that has Part A, it has Part B and Part D all together. The only thing, the disadvantages are there, I will tell you later on. So there are advantages to both the supplemental plan and the advantage plans. And I've told you about this has HMO and a PPO and a network. Medigap plan, on the other hand, does not have any network. You don't have to worry. Once you pay your premium, your monthly premium for Medigap, it does not have copay. It has a deductible. If you choose a plan G, it has a deductible, but it does not have copays once you have the Medigap plan. Medigap plan is accepted by every doctor in the United States. Anybody who accepts Medicare assignment accepts supplemental plan. Any Medigap. Suppose you live in Michigan like me. I've come to Dallas, and tomorrow, if I just want to go and get an eye checkup, not emergency, mind you, I need an eye checkup. I just call an ophthalmologist in Dallas, and I can go to the doctor and get all my treatment. It is completely covered. But with Advantage plan, that is not so. Even in your own state, doctors and hospitals do not accept certain Advantage plans. Some of them you will have to, when you join an Advantage plan, the most difficult part for me with the client is spending time finding out which doctors will take that insurance, because the patient has certain diseases, right, or some conditions, and they need to go to this doctor, this doctor, this doctor. And here I am sitting for 45 minutes on the phone trying to find out.
साइट है ना व्हाट्सएप पे, उसके पर मेडिकेयर के बारे में 1 घंटे का प्रोग्राम है.
Okay, trying to find out which doctor, whether those doctors which this patient has will accept that Advantage plan. Okay. And in Advantage plan, I've already told about HMO and PPO. And then I'm telling you about this. You have to be very careful which provider will accept your Advantage plan. Okay. But with Medigap supplemental plan in all the states of the in the USA, anybody will accept. Okay. Only certain places, when we come to Medigap, I'll tell you a little more thing about the Medigap. Okay. What does Plan A covers? Plan A will cover hospital inpatient care, as I told you. It will cover skilled nursing facility. It will cover home health care and hospice care. And it has a deductible of $1,716 in 2026. But once you have a Medigap plan, you don't get this. This is covered by your Medigap plan. You pay nothing when you go into the hospital. But if you have an Advantage plan, you will have to keep paying bills. I'll show you another slide just about the inpatient care and that. Then the Part B medical insurance will cover doctor's visits. It will cover outpatient hospital services, clinical labs, durable medical equipment like your oxygen cylinder and other stuff. Even your diabetes, those strips and all that will come under that. And preventive services. So it has a deductible of $283 in 2026. Okay. So what is Part D? So as I've said, we'll go very fast. Part D, as told, is an optional prescription drug coverage. It is provided again by private insurance. You must choose and join the plan. Plans have formularies, list of covered drugs. You pay the drug a monthly premium and you will have a small co-payment. Okay, and Part D, there are lots of plans, and each plan, depending on your drugs, it's not like that. People call me and say, Are my friend is having a WellCare, she's paying nothing. Isn't that a good plan for me? Why are you asking me to join this plan? It's not like that. Aspirin cannot be good for Chaya or it cannot be good for me. It may be good for her. It's like that. Each plan, when you go and join a Part D plan, it will depend. They will ask you all the drugs you are taking. So all the drugs are fed into thing. You go into Medicare.gov and then you put in all your drugs and it will tell you which is your best plan for you. It's very simple. It will give you the best 3 plans. You choose from that. And that also what happens is, because not all plans will cover all your drugs. That's why this. So it's a very easy thing. Once you want to get your Part D, you join Medicare.gov. It's a government site. And then through the Medicare.gov, you put in all your drugs. Once you have joined Medicare.gov, you can check whether all your drugs are already populated. Sometimes what happens is there are clients who come to me and tell me, in January, my doctor's planning to start me on Ozempic, say. So what I have to do, I have to put Ozempic in Ozempic and try and see which plan will be good. Because the plan that she's on now may not cover Ozempic. So we have to do that. So that's why you have to go into your Part D. If you have Part D, separate Part D, every year you should go and check it to make sure that the plan is still covering all the medications you are taking. And pharmaceuticals, these Part D companies can drop your drug. This year it will cover one drug, but the same drug may not be covered next year. So don't just relax and say, oh, I've got a good Part D plan, I'm paying this much and that's good enough. No, you have to check whether all your drugs are covered. And then the same thing, when you're new to Medicare, you join your Part D plan. That is any month. That is your special enrollment period. And after that, every year, you have an open enrollment period, which starts on October 15th and finishes by December 7th. Within that time, you have to join your Part D plan. October to 15th, you can change your Advantage plans. And then there is another one for Advantage plans. They give you another little period to change. Suppose you're not happy with the Advantage plan, which you started in November. October, you change one plan, which is supposed to start in January, but you're not happy. So what you do is in January, you can go and change the Advantage plan, but not Medigap plans, okay? Medigap plans, you can change with the same company anytime throughout the year. When we talk about Medigap, it's a separate this thing I'm going to talk. Then there are special enrollment periods. Suppose you're working and you retire in the month of November. That suppose you may be 74 in November, but still it is a special open enrollment period for you because you had credible coverage, because you were working for the company and the company was covering your health insurance. So that is, and then the company will give you, the HR will give you a letter to the CMS. So once you give that letter to the CMS and they know that you were working and you were covered with health insurance, then they give you the special enrollment period where no underwriting is done. So, and then there are people, because of whatever happens to their income, they go into their low income category. There is something called low income subsidy. So if you fall into that, then also for drugs, you can get a special enrollment period.
Okay. Please don't unmute yourself.
Kuch bol rahe the. What is it they wanted? Okay.
Oh,
nothing for me, right?
Nothing for you. No.
Okay. See. Okay. Only medications that are on your plan formulary count towards out of pocket. Over-the-counter drugs do not count, nor do prescription purchase without your insurance. Okay. See, in the Part D, there is a small deductible amount. Okay. So for sometimes if you have branded drugs, remember for generic drugs, the deductibles doesn't kick in at all. Only for tier 2 and tier 3 drugs, they kick in. The deductible will kick in. The deductible is like $650 nowadays. And once that deductible is over, then you only have a very small copay. Okay, and then plan premiums also do not count towards your out-of-pocket expenses. See, when you are in advantage plans, there will be out-of-pocket expenses. You know, they tell you 5,000, 6,000, these things don't. The plan premiums will not count towards it. Then, as I said, plans may not cover medications that are prescribed for off-label use, even if the medication is on the formulary. See, the plan may have the medication in the formulary. Your doctor may use that medicine for something else. Okay, suppose you are very fat and they want to use Ozempic for fatness, and suppose Ozempic is supposed to be used only for diabetes. And if the doctors does not code properly, or if it is not justified, the plans may refuse to give you cover that medication. So, okay, as in 2024, because before this, most of the people who are in Medicare already will know about the donut and the catastrophic coverage and all that. Now we can forget this. This year, last year onwards, during the Biden regime, what they did was they brought a cap on the amount a person can spend on medication. Okay. However much your medicine may cost you in a year, okay, you will only pay $2,000. After $2,000, everything is free. Even if the drug, one tablet costs $1,000 also. So this year, they said the maximum you will spend is $2,100. In 2026, anybody with very, very expensive medicine, the maximum they will spend, suppose they have 2-3 branded medication, the maximum they'll spend is only $2,100. They will not spend more than that. But remember, you should be in a Part D plan, that is D plan, which originally covers all those medicines. Okay, you cannot go and join a plan which does not cover your medicines and then expect to pay only 2,100. Okay, sometimes this is another thing. Sometimes in between the whole year, your doctor has to justify that he's putting you on a new drug or a new expensive medicine. Once he can justify your need, you can go back to the plan and ask them for an exception. Do an appeal, and usually they will give you the medicine for 1 year, they will cover it. Okay. So now let's go to Medigap. This is a very interesting topic.
You're saying about the Medigap.
Yeah. No,
Medigap.
Yeah. This is Medigap. Okay. What is Medigap? As I told you, it is between the Advantage Plan and Part D. It just fills the gap. I told you this is the 20% of Medicare. Medicare covers only 80%. And we have this, we think 20% is very little. It's a huge amount. So what Medigap does it covers the 20%. You look here. See, if you take Medigap, suppose you have a Medigap plan, like I have a Medigap plan, okay? So if you have a Medigap plan, your Medicare Part A co-insurance and hospital costs to an additional 365 days after Medicare benefits are used is covered by your Medigap plan. Understand? See, I have an N plan. It covers 100%. A G plan will cover 100%. So when you go into, God forbid, we have to go to a hospital, become sick, we are not paying anything. Our deductible, everything is covered by our Medigap plan. And then, again, Medicare Part B co-insurance or co-payment. Okay? If there's any Part B co-insurance or co-payment, it's covered 100%. Plan G, which is the most popular Plan G, and Plan N. These are the two most popular and very good plans. So these two cover everything, the Part B co-insurance, co-payment. And then, suppose we need blood. All the blood, 3 pints are all covered by all our plans, okay? But, if you get into hospice, you will not see a bill. Skilled nursing facility. This is Under Medigap, you have Medigap A, Medigap B, Medigap C, Medigap D, all these letters. Let us focus on what used to be there. It was the best plan. But now after 2020, after 2020, anybody who becomes 65 after 2020, they stop this F plan. They cannot apply for it. It's a very expensive plan, but it is very good. Once you pay your monthly premium, nothing, you will not get a penny in a bill. G plan is also very good. Now the most popular is G plan, but in the G plan, you have about 220 or $220 this year. We have a deductible, 280, I think, $280 deductible this year, 2026. Once we finish the 226, then we are all free. Nothing. You will never see a bill in the G plan. Okay? In the N plan, what happens is there will be that $280 deductible in the N plan. Everything is the same. Only thing, when you go to the doctor's office, the first time consultancy, you will have to pay $20. Okay. And usually some doctors take it, some doctors make it 16, some 20. But remember, for physiotherapy, because for physiotherapy, and mind you, physiotherapy is completely covered by Medigap plan. You don't pay anything. Once you get a prescription for your physiotherapy, whether it's 20 days, 30 days, whatever it is, there's no problem. You just go. The same thing with a chiropractor. You go for chiropractor, you don't even need a prescription with the Medigap. With the Medigap policy, you just go and see your chiropractor. It is fully covered. And the best thing is about foreign travel. So the foreign travel, what happens is, when you suppose that you go to India and we have an emergency, the first $250 Medicare will not pay. But once we have to come back to US and claim the rest of the money. Okay, so this is the best part of Medigap plan. So in the Medigap plan, you have a plan G with a little deductible. F has no deductible. There used to be an excellent plan C, which was just like F. You know how much people were paying? Just $120 for their whole lifetime. They were paying the same money every month. And they did not have to see a single bill. But that is gone now. C plan is gone, F is gone. But in F also, in F and some other plans, you get high deductible F plan and a high deductible G plan. This is, in that what happens is there's a huge deductible. This is good for people like, there are people who are from here who have Medicare, but they live in India most of the time. They have gone to India, they live there most of the time. And then they come here for 3-4 months to be with their children. For that time, it is good enough. If they have a high deductible and they are healthy, when they come here, it just covers what, for an emergency when they are in this country, it works out better because the premium is small. But other than that, I wouldn't take a chance. Then I was talking about Medicare Advantage plan. I already told you. These are, how Medicare Advantage plans are done. The government, these are also private companies like Humana and McLaren and the Priority and all these. These are all Advantage plans. Advantage plans, how they are run is the government gives them a lump sum to these companies. They say, okay, here's this much money. You run this Advantage plan. And they have to take care of the client's health and make a profit. They get only a fixed amount. Okay, that is how they run it. So with Medicare Advantage plan, there are some restrictions, but they are very cheap. They are much cheaper. But in the long run, they won't be cheaper if you are a healthy person with an Advantage plan, no problem. But health is something we cannot predict, right? Or we cannot say with 100% guarantee that I don't have to see doctors at all. There are HMOs and PPOs, as I have told you. But then, there are people who cannot afford the Medigap plans. their income is a little, I mean, it's too much to get Medicaid, and it is too little to afford Medigap. So what they do, they choose HMOs, and people who don't want to spend money and want to take the risk also do HMOs and PPOs. But in the long run, you will see, you will keep getting bills, co-pays, co-insurance, on and on and on. I have had clients for years, they have had Advantage plan. And then when they had surgeries and physiotherapy and this and that, they'll come and tell me, Mona, I'll spend any amount. Just get me a Medigap plan. Then what happens, right? This is what happens with Medigap and Advantage plans. With Advantage plan, you can change it every year during your open enrollment. Okay, that is October 15 to December 7. Every year you can change this Advantage plan to another Advantage plan. But in the beginning, when you have this opportunity to join a Medigap plan is when you're just turning 65 or you are just retired from work and you've got a new Medicare card, Medicare Part B, and you're joining, that is your special enrollment period. That is the time there is no underwriting. They will not ask you whether you are diabetic, whether you have lots of condition, what you are sick, how 20 tablets you take per meal, or you are very, very sick, you have all kinds of diseases. Nothing is asked. You can buy a Medigap plan and it will be covered, okay? Once you leave Medigap plan, you cannot go back to the Medigap plan, okay? But there is only one loophole. Medigap plan, suppose you had Medigap plan for 10 years, and if there is a scam which has happened to my clients, I had helped so many, so I help them. You know what happens? Old people, they are on the phone and they don't realize it's a scam. That guy says something, these people say yes or no, that person thinks it's a yes, and they lure them with this and that, and they change it into Advantage plan without their knowledge. And when they get the card and the bill, they'll call me. They'll say, Mona, what happened? This is what. Then what happens is we have to call. If it is within a year of their changing the Medigap to Advantage, we can get back their Medigap plan. But they may charge them a little more. They may charge them more. It's called underwriting, okay? But from Medicare Advantage, you can't go to Medigap. But from a Medigap plan, you can go to Medicare Advantage during the open enrollment periods. You can go back. So remember that. The same thing with your, some of the employers, even after retirement, will give insurance, like the state government, teachers, they have very good Advantage plans with which is paid for them by the state. But those are for lifetime. They have life insurance through their employers. But remember, once you leave your employer's insurance, you cannot go back. Okay? And then now what has happened, the new employers, the kind of insurance they are giving, some of them, it looks like their Medicare is better. It is better to go with Medicare than with their employees. The coverage is not great. For that, now we have come, one of our community person from our community has, because I was working with him and I was telling him this is the template when we worked with him. So we have a template. Anybody who is retiring and who has a retirement insurance through his employer and wants to know whether Medicare is better or employee insurance is better, okay? Call me and I'll give you that template. And then once you fill that template, you will get a good idea whether to go with Medicare or to go with your employee insurance. Especially if one of the spouse, suppose one of them has retired and the other one still has insurance through work. So then the dilemma comes, whether should I take Medicare or go with my wife's insurance? Mostly this happens, you know, the wives are younger, so the men retire first and then they go on to their wives' insurance. But before it is to be cheaper, now we are finding it is not, especially if the spouse is older, already has diabetes, or some other diseases. Okay, we all have all kinds. Indians, we all have diabetes, most of us, right? So if they could be having a diabetes or some heart condition or something else also. Okay, in those cases, they know that they will need these doctors for a longer time. They will need more money. So the Advantage plan in Medicare may not be good. They may choose a Medigap plan, which may work out. But then again, it depends on everybody's finances. I've met some people, low income group people who say, look, we don't leave Michigan at all. We are not going to travel. We are not going to any state. We know our primary health doctor. He's very good. He has taken care of us so many years. We will continue in HMO. They seem to be okay. That is also good because they say this is our life and this is all we can afford. And that is also fine. Okay, but Advantage plans, remember, Medigap plan does not cover vision and dental, hearing. All this is not covered because Medicare does not cover vision, dental, and hearing. Okay, but remember, when you read Advantage plans, you have to read the small print. Go through it thoroughly with the microscope, I would say. Read everything and put it down in black and white and calculate and see if you're really, really going to save money and health. Another thing, the myth about vision plans. You don't need vision coverage. Remember, Part B covers all your vision problems. If you have diabetes, you have to get your retina checked every month. That is done by Part B. Once you have cataract, you cannot see, go and see an eye doctor. It will come under Part B. You don't need a vision thing. For glaucoma, some of you will know what glaucoma is. You must be using drops. For that comes under Part B. You don't need a vision plan. Then some of you have macular degeneration or early macular problems. That also comes under Part B. You go and see your doctor in your hospital. You see an eye doctor. The eye doctor does the eye checking. It will also give you a prescription and get your retina also checked. Okay, so don't waste money on vision plans. It's not at all worth it. Dental, Advantage plan says they cover dental. No, it's very minimal dental. Don't get carried away by dental. Read what dental you get. And after age of 65, everybody has dental problem. And we won't get small dental problems. Those days are gone. After 65, even the younger ones, it won't cover crown. They'll say you have to pay so much for crown and so much for filling and so much for that. So just read your dental plan carefully. And then the dental plans also, the cost. Another thing I forgot to tell you, all these Part D plans, Advantage plans, Medigap plans, they all go with the zip code, okay? A zip code, I have seen dental plans cost more in West Bloomfield, where I live, and than Sterling Heights and Macomb County, depending on the county. Where there are certain counties which pay less taxes or whatever, there it'll be cheaper. It'll be more expensive in your county. So all that matters, where you live, what drugs you take, and what age you are, all that. With Medicare Advantage plan, they will say dental, but go read the black and white thing. Okay. So Medicare Advantage plans this is a new thing that has happened. Medicare Advantage plans must send mid-year notice to mid-year to tell them that they have not used their vision, they have not done their dental, they have not done hearing, they are not going to the gym. And now the new thing is some of the Advantage plans give you every 3 months, they used to give $75 to buy over-the-counter drugs. Okay, now over the counter, like say aspirin, omeprazole, you can buy Band-Aid, you can buy all those things that you get in CVS without a prescription, you can buy from that card. That is one of the advantages of an Advantage plan. I told you all this already about when to enroll for Medicare Advantage plan. Okay, here's it. If you're still working after 65, even if you're taking Social Security, you do not necessarily need to enroll in Medicare, which I told you. If you already are working and if your employer is covering your Part A and Part B, but please talk to your HR what they were going to do, and then you don't have to enroll. But if you're collecting Social Security, you'll automatically be enrolled in Part A and B. Most people choose to keep Part A, I told you. If you already are taking, if you're not working, but you're taking Social Security, you'll have to join. Okay, if you have qualifying health insurance to your employer, you can refuse Part B, which I've already told you again and again. When you're ready to take Medicare, you will need some paperwork to be sent to the socials. Your HR people should be. This is what I've already told you about. If you're working, what you should do. Again, I've been telling you, be sure for all your relevant dates and deadlines, like open enrollment, annual enrollment, special enrollment, penalties for not joining Part A, Part B and Part D, and all those things. If you delay enrollment in Part D, you must get proof of creditable coverage from your employer to avoid penalty. See, if you get your health insurance through your spouse, you will need to check with their benefits coordinator and so that it is their health insurance is considered creditable coverage. That's what you have to check. Okay, now we'll talk of HSA. I think most of you must be very familiar with HSA. These are for accounts for individuals with high deductible health plans. Only people who are working and who have high deductible plans, that is why they have the HSA. Funds are not taxed to deposit or to withdraw. In HSA, I'm sure you all must be experts at HSA. So you know how the funds are not taxed to deposit or to withdraw. In order to deposit, you must have an high deductible health plan and have no other insurance. Okay? Enrolling Medicare and health savings accounts. Let's talk about this. Okay. Enrolling in Medicare Parts A or B, you cannot contribute pre-tax dollars to HSA. Okay? And stop contributing the month your Medicare coverage begins. Remember this. You cannot contribute pre-tax dollars, and you should stop 1 month before Medicare coverage begins. You can withdraw tax-free to pay qualified medical expenses. Okay? Let me remove this bar and I'll take it up and... Okay. Medicare pays primary to the job-based coverage. Okay? So, can withdraw tax-free to pay qualified expenses. Medicare pays primary to the job-based coverage. So, Medicare pays first, then only the job-based coverage. Okay, Part A and B. Let's go back. Delaying enrollment into Parts A and Part B. Receiving health coverage from an employer with 20 plus employees. So, if you are, again and again, I'm repeating the same time. If you have health coverage from an employer who has 20 or more employees and wants to continue putting funds into HSA tax-free. If you have an HSA account and you have good health coverage through your employer and you want to contribute to your HSA, then don't join Part A and Part B. And then you can use a special enrollment period whenever you want. Whenever you want to change into Medicare, you can stop contributing money to your HSA and enroll in Medicare. That is the way to do it. But make sure you get that letter. It's called CMS Form 1 something. I will post it in WhatsApp group. Okay, now this is IRMAA. IRMAA is income-related medical adjustment amount. Okay, please be aware of this. I'm going to bring this down so that it doesn't. Okay. See, income-related Medicare adjustment amount. my friend, recently my friend, my very dear friend, she said, मेरा security, social security कम हो गया 500, मेरा social security कम हो गया, मेरा social security कम हो गया. This is what she kept saying. So I was wondering, how can they, take away, or, how can it become less? I said, what happened? What did they do? And then I did not understand that she did not know that she had some inheritance which was given, she had, and that put her into that bracket, income. See, whoever gets, there are certain income, there are 6 income categories. Each category has a set dollar amount associated with it. See, if by chance you inherit some money, suppose you sell your own home in India and get some money, this is how, what happens is, that amount increases your tax bracket. So once you go into a different tax bracket, this Medicare adjustment amount will also kick in. Your Part B amount will go up, your Part D amount will go up, and then for this they will take 2 years into consideration. And then once that year is gone, then it comes back to the original. So before you get money, like now, if you think that you're selling some stocks or something and your income bracket is going to go into a different category, please talk to your tax person. I'll show you here is it. This is for Part D. This is just for your medical plan. Okay, this is for your prescription Part D plan. Suppose if you are an individual tax filer and with the income of 100 less than 106,000, and your Part D will be 0 up to 106,000, and if you're a single filer, your Part D amount will be 0. But once it is 106 to 133, your plan premium, you have to add $14.50 to your plan premium. Okay? But I'm just talking about the single people. For the couples, it is more. For a couple, see, if it's 212, also they only pay $14.50. It is not fair for the poor single people like us. So 133 to 167, you pay $37.50. But this adds on to your medicine. You must be paying a premium for your Part D. Okay, say $15. But actually, you will be adding 15 to 15, $30. Or $15 here, and you go into this bracket, you will be adding $37.50 to your premium of Part D. The same thing, if you go into this bracket, you will go. Another thing, people in my age group, in the 73 years, once you hit 73, there is RMD. That is what, what mandatorily you have to take out this amount. I keep forgetting. What is it called? RMD or required minimal distribution. Okay. So what happens is compulsorily you have to take out money from your IRAs and all that. So then you may go into this bracket, and then all this will happen to us depending on how much money we are taking out. So please don't forget this was 225 part, 2026 is also there. If anybody needs it, I can send that also. So beware of all this. IRMAA is very important. So before you sell anything or increase your income by any chance, make sure, because your Part B also will go up. So Part B won't be the standard 202 this year, I think, and 202 or 20, whatever. For 2026, you'll have to add all this. Your Part B will go up, Part D will go up. They have not shown the Part B. There is somewhere else, I'll show you. Help for people with limited income. It's a very nice thing. Once you have a limited income, you can apply for extra help. There's a form. You can go on to go into Social Security site and apply for it. It's called extra help with prescription drugs. And then for Medicaid, Medicare savings programs, prescription saving cards, pharmaceutical assistance. Okay, you all must be knowing, most of you, I'm sure, know about GoodRx, Single. There are so many of these prescription cards, saving cards, which are genuine. You can use it, but and they save a lot of money for certain people. You can use those. Okay, enroll on time. See, Part B late enrollment period is 10% of the standard monthly premium for each month. You should have enrolled but did not. See the penalty. If you should have enrolled in October 2023 and decide to enroll during general enrollment in January 2026, you will pay an additional 4130 and on top of 206 for Part B. So imagine the penalty. As the premium changes, generally goes up every year, so will the amount you pay as a penalty. Same thing with Part D enrollment penalty. So your part, and it will come throughout your lifetime. This doesn't stop. At least for IRMAA, you have to pay the tax only for 1 year, and then the next year, once your income goes down, then you can go back to the Part B. The older one. That's called IRMAA, special enrollment periods. And so as I told you, that is why once you retire from work, and that will be a special enrollment period. Involuntary loss of creditable coverage, entering, residing, or leaving long-term care facility, moving. And life changes, like if you get divorced and go away, or if your spouse dies and you move into another state, then also you get a special enrollment period. And I told you, first year trial period for Medicare Advantage, you can use that within that 1 year, you can switch from Medicare Advantage to Medigap, or from Medigap into Medicare Advantage. Okay, you may qualify for a Part D special enrollment, but not in all cases. Okay, again about creditable coverages. A creditable coverage is coverage that's at least good as what Medicare provides. So your insurance should be as good as Medicare. However, with the 2,000 cap on medication, many businesses may find that the plans they are offering no longer are at least as good as they may have, for example, 3,000 cap on medication. I was telling you that from Biden's time, there's a new rule this year. However expensive your medicine may be, whatever the cost, the original retail cost of the medicine may be, you will only pay $2,000 per $2,100 per year. But now what is happening is some of the companies may have a 3,000. They cannot afford to give you $2,000 for 2,000 cap for your medication. So they may be giving a $3,000 cap on medication. So that may not be creditable coverage when you switch to Medicare, and you may be penalized. So please find out. To resolve this, CMS stated that if a plan was considered creditable in 2024, it will still be considered creditable in 2025, so as to avoid a major problem. Okay, but we don't know what will happen in 2026. So if you're working for a company, and please, all the retirees who are over 65 and you're continuing working in some companies with more than 20 employees, make sure that you have creditable coverage. Okay, now with advantage plans, the advantages of having advantage plans is in Medicare Advantage plans, there are some special need plans. So when these special need plans are plans called, there are 2 or 3 different kinds. One is special need plans, which is called a D-SNAP, which is usually the D-SNAPs are dually enrolled. That means I told you they have Medicare and Medicaid. There are people who are older people, above 65, who have Medicaid and Medicare. So for them, there are special D-SNAP plans, which are cheaper and they give them more little benefits. They are all HMOs and PPO plans. They are plans with people with C-SNAPs. C-SNAPs is the more chronic ones I see. C-SNAPs is meant for people with heart disease, kidney disease, HIV, diabetes, any chronic condition. They can join this plan. And there are plans for people reside. There are other special plans, people who are residing institutions who require a level of care provided by long term. So if you are in a long-term care facility or in a nursing home also, you will get ISNPs. These are different advantage plans. They are meant for certain group of peoples for which the chronic SNP I do a lot, because for diabetes, heart disease, and in this advantage plans, till this year, there are some of the plans that they give you a flex card where these people can even buy food from the grocery store. Some of them, some of the plans give you not only like the over-the-counter drugs, they can use it to buy milk or nutritious food for chronic SNPs. But I mean, anytime anything can change. So don't do it alone. If you are interested in SNP, especially, it is very important that you educate yourself and talk to a counselor. It can be complicated to navigate the programs and services. There are also strict rules applying for and changing plans that need to be understood and followed. Especially for special need plans, please, please, always consult a counselor. Okay, now let's talk about healthcare marketplace and Medicare. Marketplace and Medicare, they are not designed to work together. When you become eligible for Medicare, you should drop marketplace in favor of Medicare. Okay, if you do not enroll in Medicare, you may lose tax credits for marketplace. Be penalized for not enrolling in Medicare if they enroll later. If you sign up past your initial enrollment period at HC where you are considered new, you must have proof of creditable coverage to avoid penalties. Okay, this affects people who have their own, either they are self-insured through marketplace, or I have seen very rarely, I have seen parents of our community, they come here from India and they have income. So they don't want, because they have income, they don't qualify for Medicaid. And because they have not worked in this country, they have to pay $500 per month for Part A. So it works out very, very expensive. So they choose to use only marketplace. But they do not get any tax credits. People with green card who come into this country till now, I don't know what is for tomorrow. The green card people whom I get marketplace, people who come just for the first 5 years with the green card, you are not eligible for Medicaid. Okay. So these are people who have no income, nothing in this country, neither in India nor here. So what these people do is, for them, I get them a Medicaid denial so that they can join marketplace. And when they join marketplace, till today, all the money they spent on their insurance, Obamacare, was there. They get it back in their tax credits. So it's like getting a free health insurance for the first 5 years. And once they do 5 years in this country with the green card, they all become eligible for Medicaid. That is, if their income matches the Medicaid requirement. Okay. And then suppose these people who are in marketplace, they try to enroll in Medicare at a later age, they will be penalized. It will work out very expensive. Okay, there are certain marketing guidelines. Though we get so many scams and calls, they are not supposed to do it. But that will go on, Even advertising, wrong advertising, calling people on national and state, do not call, enroll people over the phone, engage in mislead and confuse. They will come and call you. They'll say, oh, we'll give you this, we'll give you that. And that's all scams. So you know that, find problems. Medicare Preventive Services. Shall we take questions now, Chaya?
Yes, I think we have a couple of questions in a group chat. I can ask them to. It's a long
go ahead.
question, so I'll ask them. But how many slides left? Because it's past 10 past 9.
What is the number of this slide? I don't know.
Yeah. How many you
Okay.
want to cover? It depends.
Okay. You know
just
about Medicare preventive services. These are covered, like before itself, I
Yes.
said, preventive services are covered by Part B. Original Medicare pays nothing for most preventive services from a provider who accepts assignment. Another thing I want to teach you all, one special word today. Please learn this word, Medicare assignment. Whenever you call a doctor's office, they may say, oh, I take Medicare. The receptionist will say that. No, make sure they accept Medicare assignment. Once they accept Medicare assignment, they have to follow the rules of the Medicare. They cannot charge you extra. If you have Medigap plan, it will completely, the Medigap plan will pay for it. You are not supposed to get any bills. In an Advantage plan, there is a fixed amount for a provider. That's the only thing. The provider cannot charge them more. But if they say we take Medicare, but we don't take Medicare assignment, they can charge you 15% more than what Medicare pays them. So they will get paid by Medicare and they'll make you also pay them. Okay. So this is a word you should learn. Like Mayo Clinic or something, they do not accept Medicare assignment. There may be some excessive charges, which is covered by Medigap, but this Advantage plans don't cover. Suppose you want a second opinion. You want to go to Mayo Clinic or one of these big places for a second opinion for your problem. Some of them may give you excess charges. So if your plan G, then excess charge is covered. Advantage plans don't cover excess charge. Excess charge is very rare, okay? But just to know that if you go to second opinion places, there may be excess charge. Be prepared for that.
Okay, Mohana ji, how many slides
No,
you want
very
to cover?
done.
Done? Okay, yeah. Once you are done, then. Oh, done.
Yeah.
Okay.
We don't need all this. Okay, all the wellness and preventive services, what you get with Medicare is here. And as you all know, all this, you get cardio screenings. Mammograms should be free for everybody. Should be no cost. Prostate cancer screenings from Medicare, once you join, it'll be no cost. Make sure you don't pay. Flu shot is free. Please take it. Pneumococcal shot is at no cost. I want to tell you all. And bone mass, please, all the ladies and the men in our group, whoever's listening, please go for your bone density. Do not neglect that. You may think you're strong, but get your bone density. It is free, no cost. Glaucoma test every 12 months. If you're high risk, it is. 20% of doctors visit our hospital, copay may be there. Okay, PAP test every 24 months. HIV virus screening every 12 months. COVID vaccine as recommended. This could change when we don't know about COVID vaccines. Make sure. Shingles vaccine. This is become free. Okay. But you should have a Part D coverage. I paid $360 before COVID. Yes, I paid shingles $363. But now it is free. But we do not know what will happen to this. Okay, tetanus is free.
I'm going to take out the number.
Okay, all this. Now, next, go to the last one. I've already told you about scams and, be very, very careful. Okay, done.
Okay. Okay, thank you, Mohana ji.
How a counselor helps you. I'm telling you, we'll make you understand your health plans. We will compare and show you all that. See, we do not sell and tell you this plan is good, please join Chaya. No. We will show you all the plans and we'll tell you the advantages, the disadvantages. And then we will sit with you and we will work out everything. And it is up to you. Whatever plan you join is your decision. Okay? And we don't get commission, nothing. You join Advantage plan, Medigap plan, whatever feels good for you, you have to do it.
Yeah.
And we have to tell you all the truth. Okay? That's it.
Thank you, Mohanaji.
Okay,
That
let's
was
start with
First,
questions, Chaya.
yes, thank you, Mohanaji. This is very informative session. Let's start question answers now. I see quite a few questions there in the chat.
Let's start.
Some of those are actually very long ones. So I'm just going to call the name, and please you can
They
just
can tell me
unmute
what they
and
want.
yeah.
That's all.